AI saves lives. Shannon just told you that it saves lives in firefighting, construction, transportation, and not just in those areas. It helps us become healthier and lead better lives. Its advances in healthcare and healthcare technology is changing lives around the world. The first change is in imagery assistance. In the past, to detect if you have a skin cancer might take hours or weeks, thousands of hours to determine if that's right. But with AI, that takes now minutes. And you may think, oh, that's saving a lot of cost. Yes, that's also saving a lot of doctors' time so that they can focus on other people. But it's also helping lots and lots of people who may not get medical care. I met Lei last year at a conference. He comes from Gansu, a very poor region in China. Now, when he was young, he always think that people get blind when they get old. Why is that? Because in this area, there's not enough eye doctors in China. Of the 13 billion people, they only have 36,000 eye doctors. And in his country, in his province, his relative died of diabetes, which can be detected by retina imaging. But that technology is not available. They don't have enough doctors. But with the machine that he invented with AI-powered imagery assistance, this can be done in minutes. And his machines is now in hospitals all over China to help people detect diabetes and other dangerous diseases so that they can get care much earlier. So AI is good for humanity. These people would otherwise not have these resources. And what could take weeks and delay treatment could now be much faster. Not only is it helping in image assistance, with AI-powered imagery combined with speech recognition, we're actually creating robotic nurses who can be there 24/7, who's not emotional and who's not tired. And this is a huge impact. Who has grandparents? A lot of them would need help, but we can't find help that we need because they're expensive or they're not available. But with robot nurses, they could help. They need. And this also happens in hospitals. When they need care, robots can help. Now, this is not only helping hospitals. I watched a video of Ed. Ed is an engineer who's blind. He could not see since young. But when you combine imagery with speech AI, he has now glasses, which can tell him what's in front of him. So when he goes to the parks, the glasses tell him, hey, there's a dog in front of you. You should make a turn. Can you imagine that on the life of Ed? When in the past, everything might be in the darkness. But now, with AI-powered imagery and AI speech, he can live, potentially, just like you and me. In this world, there's more than 300 million people who might benefit from this. AI is good for humanity. And lastly, I want to talk about robotic surgery. Did you know that robotic surgery can decrease 21% of hospital stays because they're more accurate and they don't get tired and they're not emotional? And did you know they can decrease 5 times the complication after surgery? Now, I would ask myself, would I want a robotic surgeon or do I want a surgeon to do a surgery on me? AI is good for humanity.
What good does it do this man who has glasses if his entire village has already been wiped out by a virus created by artificial intelligence?
Okay, we live in the real world and not in a sci-fi world. So if we treat every invention thinking that, oh no, it's going to kill every race, what good does it do? We will never have progress and we wouldn't be where we are today.
What if, in medicine, and I think this has already happened, but what if on a larger scale, AI begins to misidentify something like cancer recommends a treatment that is unnecessary, and people are harmed on a massive scale because robotic doctors are working on a massive scale instead of humans who can catch such errors.
Oops. Human makes the same error. And every year, I can't tell you how many people actually dies from miscalculation, misdiagnosis. And what we've seen so far is that AI actually make better predictions and better diagnosis. So I think it actually will help human beings and help doctors make better decisions.
So if it's already proven to help more, why isn't it done on a massive scale?
Because we're in the very stage of getting them right. We're very cautious about AI technology, and I can see from Shannon's discussion. So it will be when it's ready, but now we're trying it out. It's already showing a lot of improvements and a lot of progress.
You talked about living in the real world today. So if you can imagine a world where AI and nurses and doctors can treat people better than human nurses and doctors, I think we need to actually stretch our minds to think about. I want to ask you if you can stretch your mind to think about AI that could be used in the hands of dictators and kill millions of people. Do you think that's possible?
Every technology in this world could be used by good people and bad people, but that does not mean we don't develop it. We should always think about its benefits and guard its access. I think that's what we should be doing. We shouldn't say, oh, guns is going to kill people, so we don't invent it. Oops, that's a bad example. I should say, oops, I should also say Hitler has killed thousands of people.
Are we done? We're not done now.
All right. I was like, bring it.
You have one more question?
10 seconds.
So AI is good for people.